Good morning, USRNs! Today, pag-uusapan natin si Musculoskeletal. Dito sa Musculoskeletal na pag-uusapan natin ngayon, kasama dito yung mga sakit ni arthritis. Nandito rin si osteoporosis. Nandito si carpal tunnel syndrome, si orthopedic surgery, si Paget's disease, osteomalacia, fractures, casting, compartment syndrome. Under arthritis, kasama dito si rheumatoid, osteoarthritis, si gouty, and si septic arthritis. Kung meron mang hindi nabanggit sa notes na to, siguro gagawa ako ng panibagong video na kung saan kasama na yung ibang diseases under musculoskeletal. So una, pag-uusapan natin si musculoskeletal. Pag-uusapan natin si bones. Si bones, siya yung framework ng ating katawan. Pag wala tayong bones, hindi tayo makakatayo. Lupay-pay lang tayis, ganun. So si bones, siya rin yung nagsusupport ng muscle. Siya rin yung storage ng calcium. So, merong mga disorders si bones. Pinakauna dyan si arthritis. Si arthritis, ito yung inflammation ng joint. Kapag tinanong kayo kung ano yung causes ng arthritis, meron tayong mnemonics na tinatawag nating ahoye. Ahoye. So, kapag nakakita mo si arthritis, isipin mo si Aladdin. Si Aladdin na may arthritis. Alam niyo yung kanta na Ahoye World. Ahoye, A-H-O-Y-I. Ahoye causes autoimmune, hereditary, obesity, your diet which is bad, and infection. Pagdating sa diet, ang highlight dyan is si gouty arthritis. Kasi si gouty arthritis is caused by a high purine diet. Sa infection naman, nandyan si septic. Huwag kalimutan si septic kasi si septic madumi. Diyan nilalagay ang tae. Kaya septic. Charot. Para lang maalala, no? Maalala nyo, maalala ko. Ganun. So, ang diagnostic test to check on arthritis, we have 4. We have the mnemonics. RACE. R-A-C-E. Röntgenogram, which is the other name for X-ray. Nandyan din po si arthrocentesis. Si arthrocentesis, there will be an aspiration of synovial fluid, diagnostic test for rheumatoid arthritis or septic arthritis. During the aspiration of synovial fluid, you need to watch out for cloudy fluid. That denotes infection. Si CRP naman, which stands for C-reactive protein, isa sa mga test ni arthritis. And we also have ESR, the erythrocyte sedimentation rate. Diagnostic test naman ito for autoimmunity. So si arthritis, meron siyang 4 na types. Si rheumatoid, si osteoporosis, si gouty arthritis na nakukuha because of our bad diet, mataas ang purine. Meron din si septic arthritis na nakukuha naman through infection. So, akalain nyo, pwede pala tayo magka-arthritis na tinatawag natin septic arthritis because of infection. Pinakauna si rheumatoid arthritis. Meron akong friend. Ang pangalan niya ay si Rio. Si Rio, malibog siya na friend. So, tinitigasan siya lalo na pag umaga. Kaya siya yung palatandaan ko dito. Kasi si rheumatoid arthritis, meron siyang morning stiffness sa extremities and sa joints. So meron din siyang joint deformity na tinatawag nating swan neck. Nakita niyo yung neck ng swan? Parang deformed, like nakabaluktot. No? Kaya tinatawag na swan neck or joint deformity. Rheumatoid arthritis is an autoimmune disease or systemic. So autoimmune, ibig sabihin, Hindi mo siya pwedeng gamutin ng corticosteroids. Pwede mo siyang gamutin ng corticosteroids kasi ano siya, autoimmune. So again, tandaan, kapag autoimmune ang isang sakit, hindi lang sa arthritis, pwede mo siyang gamutin gamit ang corticosteroids. Fever is expected sa autoimmune disorder. Si Rio, meron siyang complication na tinatawag na Volkmann complication or Volkmann's contracture. Volkmann contracture, ito yung contracture kung saan merong decreased blood supply on the affected extremities. So, paano natin i-manage si rheumatoid arthritis? We have warm bath or warm compress, which is the priority. Methotrexate, which is the gold standard of rheumatoid arthritis. So, ito yung pinaka-main na gamot na binibigay kay rheumatoid arthritis. We have the DMARDs, DMARDS, which means disease-modifying anti-rheumatic drug. Ang example po niyan is si hydrochloroquine. Pwede rin tayo magbigay ng pain meds. Example, NSAIDs, COX-2 inhibitor, Celebrex, and Arcoxia. Tapos kapag si rheumatoid arthritis matutulog na, bigyan niyo siya ng firm mattress. And syempre, because rheumatoid arthritis is an autoimmune disease or arthritis, we should give corticosteroids to the patient. Okay. Ang pangalawa naman ay si osteoarthritis. Ito yung joint pain na hindi nare-relieve ng rest. This is hereditary. This is caused by overweight. And because this is not an autoimmune disorder, not an autoimmune arthritis, corticosteroids is not given here. May dalawang nodes si osteoarthritis. Pag tinignan nyo sa kamay nyo, dyan sa pagitan ng daliri nyo, ang taas niyan, tinatawag nating Heberdines. Ang sa baba naman yan, Bouchard. Ayan. So, para hindi nyo makalimutan, si Heberdine, the first letter is the letter H, high, so nasa taas. Si Bouchard naman, the first letter is letter B, so nasa baba or below, no, or bottom, just like me. Charot. Ayan, so management naman dyan. So dahil yung cause ng osteoporosis is obesity, i-manage natin yung weight. I-reduce natin yung weight. Pwede rin siyang i-warm compress. Pwede rin siyang mag-take ng pain meds, NSAIDs, etc. Same thing with rheumatoid arthritis kasi meron ding pain dito. Kasi yung pain nga dito hindi nare-relieve ng rest. So kailangan natin ng medication. COX-2 inhibitor. Tapos dito pwede din tayo magbigay ng herbal meds na tinatawag nating glucosamine. Isa sa mga example yan. And sa US nga pala, even if it's a herbal medication, kailangan natin ng prescription from a healthcare provider. So, yun. The third kind of arthritis is the gouty arthritis. This is due to high purine diet. Ang nangyayari dito, there is an accumulation of uric acid into your joints. So kapag kumakain ka ng food that is high in purine, mag-a-accumulate to sa joints natin to form uric acid. That will lead to tophi formation or tophi formation, however you want to read it. That will lead to pain. Si tophi formation, it will cause inflammation and podagra. Ang ibig sabihin ni podagra, siya yung big toe sa paa nyo. So, tandaan lagi si podagra kasi si podagra, siya yung asawa ni podagro. Charot. So, sa hilalaki ng paa nyo, pag may nakikita kayong tao na may parang bukol dito or umbok sa hinlalaki ng paa niya. Yun yung tinatawag na podagra. Dahil nga nag-accumulate yung uric acid, doon naiipon sa joints natin. Yung joints natin, ito yung mga buto kung saan pwede natin siyang tupiin or galawin or igalaw. Ang pangit ng term ng galawin. Alright, so management for gouty arthritis, we have 3 prescriptions or 3 drugs. We have allopurinol, colchicine, and probenecid. Si allopurinol, siya yung tumitigil sa crystallization ng uric acid. Si colchicine naman, it's for severe pain. Probenecid is for uric acid diuretics. All drugs are nephrotoxic. So, ibig sabihin nakakasira ng kidneys. Kaya, kung maaari, kung ayaw nyo maggamot, daanin na lang sa diet. Pang-apat na klase or the 4th type of arthritis is the septic arthritis. Yung pinaka-cause nito is infection. Signs and symptoms, of course, kung may infection, signs and symptoms is fever and sore throat. Meron ding joint pain, of course, body malaise, and skin that is warm to touch. Dahil the cause of septic arthritis is infection, the management should have something to do with infection, antibiotic. Those drugs that has mycin at the end, like aminoglycosine, antibiotic, which is a potent antibiotic, which also causes nephrotoxicity. So, para matulungan naman i-flash kahit pa paano yung effects or content ng gamot, we can also give out fluid, the isotonic and hypotonic solution, or whatever is available. But your priority should be isotonic. Para hindi mo makalimutan si isotonic na priority siya, you can put it as first tonic. By the way, the review center that I'm using is under Simplify. They are located in the Philippines. The program offers like unlimited review until you pass your NCLEX. Meron din siyang Q-Banks question. So, pinag-uusapan dito yung pathophysiology. Alam naman natin sa NGN ngayon is na kailangan natin yung content. So, dito sa discussion yung Sir Choki sa Simplify, if you want to visit their Facebook page, and enroll, you can also do that. Dito, every time that he makes his review, tuturuan niya kayo kung paano gumawa ng pathophysiology. And those pathophysiology is so helpful because you will really trace the main cause, the root cause of a certain disease. Alright, so pag-usapan natin si osteoporosis. Osteoporosis is a degenerative bone disorder. So, para hindi makalimutan si osteoporosis, ang mnemonics nito is si osteoporosis din. So, O for old age. Ayan, kita. S for smoking. T for trauma. E for endocrine problems. Obvious family history. Pregnancy. O ovarectomy. Removal of the ovaries. Race common in Asian and African American or African people. Ko na mabasa. Over intake of caffeine and alcohol. Small thin body frame. Inadequate calcium intake. And sedentary or steroids usage. Ang signs and symptoms ni osteoporosis, we have the mnemonics break. Weak bone is equals break. Break as in makipag-break sa jowa. B for bone pain. R for reduced height. E for easily fractured. A for always fall. K for kyphosis. Kyphosis, other name is Duager's kung sa Tagalog pa, kuba. Management niya is diet. So, meron dyan si milk, yogurt, cereal or oatmeal, fish with fine bone, and turnips. Exercises could be high impact or low impact exercise. Medication for osteoporosis, we have calcitonin. We also have biphosphonate. This is a phosphorus binder. Si Fosamax, siya yung pinaka-famous or common na biphosphonate. And also we have alendronate or risedonate or risedonate. Okay. Si Fosamax, paano ba siya i-administer? Merong 4 na steps. Hindi siya pwede interchange. It needs to be in order. The first one is give the medication before breakfast. Number 2, you need to pair it with a glass of water. Number 3, you need to place the patient on an upright position for the first 30 minutes to an hour. And fourth one is you need to document. Ayan. So that was osteoporosis. Now we have osteomalacia. Osteomalacia, ito yung sabi nila kay Catherine Bernardo daw, yung parang sakang. Pag adult, osteomalacia. Kapag pediatric patient, it's rickets. Signs and symptoms of osteomalacia includes weak bones, bowing of the legs. Ito yung hallmark sign niya. And syempre, merong bone pain. Management of osteomalacia, you need to eat food rich in vitamin D, as in David. No, calciferol. Mnemonics ng vitamin D rich food is Beko. Yan yung paboritong pagkain ni Catherine Bernardo, Beko. Stands for bread, eggs, cereals, oatmeal. Kung wala kang budget pang food, labas ka na lang sa arawan. Pero wag masyadong painit. 10 a.m. onwards. Hindi safe. Ayan, next pag-uusapan natin is si ano ba to? Meron kasi dito si Paget's disease. Yan, si Paget's disease muna. Paget's disease, it sounds like pangit. No, sorry, Paget's disease. Meron siyang deformity sa face. The other name for this is osteitis deformans. There is an abnormal bone metabolism. So, nag-increase si osteoblast and si osteoclast. Osteoblast is for bone remodeling. Osteoclast is for bone destruction. It will lead to pain, skeletal muscle weakness, and mosaic-like appearance. Yun yung tatlong SATA answers dyan. Pain, skeletal muscle weakness, and mosaic-like appearance. Pag gusto nyo ma-appreciate yung itsura ng tao na may Paget's disease, you can search it on Google. Management, gamot niya is si biphosphonate. This control and normalizes osteoclast activity. Osteoclast activity is bone destruction activity. Other management niya, do not do cold compress sa mukha because this causes vasoconstriction. If vasodilation takes place, it will decrease blood flow and increase lactic acid. Lactic acid formation, syempre, it will lead to more pain, no? Ayan, so you need to watch out for platybascia. Platybascia, nangingialam, platybascia. Charot. Platybascia, siya yung cause of death ni Paget's disease. Causes of respiratory depression, kasi there is an increase of intracranial pressure that will lead to seizure, that will lead to coma, that will lead to death. So next we have let's do compartment syndrome. Si compartment syndrome, meron siyang 6 P's. Si poikilothermia, wherein the skin is cold to touch. Paresthesia, tingling sensation or funny feeling. Pain that is not relieved by pain meds. Pallor, pulselessness, and paralysis. Cast syndrome related to hip spica. Signs and symptoms, we have abdominal pain, abdominal tenderness, absence of bowel sounds. Management for cast syndrome is readjustment, gastric decompression, and gastric esophagoduodenostomy, ang twister. Ayan, so si cast, paano ba natin gagamitin si cast? Si cast, siya yung immobilizer. Dapat sinusuot to all of the time. Sa types of cast, we have plaster of Paris and fiberglass. Let's compare them when it comes to quality. Cotton, kay plaster of Paris. Polyurethane naman si fiberglass. When it comes to cost, plaster of Paris is cheaper. When it comes to color, plaster of Paris, kulay niya white. Si fiberglass, kulay niya green, blue, pink, neon. Pagdating naman sa tuyuan, drying time, plaster of Paris is 1 to 2 days. Si fiberglass will only take 30 minutes. The weight of plaster of Paris is heavy. Fiberglass, it's light. Yan. Meron tayong cast care. Si cast care, inom lang ang tubig. Cast care, meron tayong mnemonics na casted. The first one, clean with microfiber or damp cloth. Assess distal pulses. Support or sling. Turn every 2 hours. Elevate to promote venous drainage. Dry using hair dryer in a cool setting. Yan, so yun yung care ng cast. You need to watch out for tight cast. Because if the cast is too tight, it will increase the pressure of the fractured site. That will lead to irreversible pain. That will lead to compartment syndrome, pressure that cannot escape. Management, we have cast readjustment. We have petaling, bivalving, windowing. Report to healthcare provider if readjustment won't work. And so technically, pwede ko namang basahin na lang kasi pwede ko naman siyang pakinggan ng paulit-ulit, which works for me. Ay nga pala, we will talk also about carpal tunnel syndrome. Carpal tunnel syndrome, ito yung sa kamay natin, merong compression of the median nerve. Signs and symptoms niya, we have the mnemonics PIN, which is pin, stands for pain in the fingers, inflammation, and numbness or paresthesia. Yung risk dito is yung mga tao na laging ginagamit yung daliri, halimbawa secretary, teacher, nurses, drivers, or kung sino-sino pa na sa call center. Yan. Management, pain meds, we have NSAIDs, COX-2 inhibitors, steroids, kasi nga may pain. Pwede rin tayo gumamit or uminom ng vitamin B12, vitamin B1, B6. Ito yung vitamin B supplements. Kapag hindi nadaan sa pain meds, sa vitamin B supplements, pwede tayo magpa-surgery. Tawag dyan is endoscopic release of carpal tunnel with rod and video. Tips for post-op, no heavy weight lifting on the affected side. Ayan. Orthopedic surgery, example niyan is a total hip and knee replacement, use of mechanical prosthesis. Tips dyan is to avoid flexion and overstretching, use of high-raised toilets, use abduction pillows, lug rolling. Amputation, it's removal of the limb. Risk for amputation, those are patients having diabetes mellitus, bone cancer, peripheral arterial disease or PAD, trauma or gangrene, burns. If patient is having amputation, assess for glucose and dietary intake. Prior amputation because of the sluggish blood flow. You need to establish glucose first. Post-op naman, patient is expected to complain of phantom limb pain. You need to watch out for compartment syndrome. Use assistive device, rehab program, and for positioning for post-op patient after amputation, for the first 24 hours, you need to elevate the foot of the bed from 30 to 40 degrees to prevent edema. After 48 hours, prone position 3 to 4 times a day for 30 minutes. Strengthen the gluteal muscle and prevent hip flexion. Lalabas sa exam yan. So, pag-usapan naman natin si fracture. Si fracture, ito yung injury that alters bone metabolism. Merong klase-klase. May 3 types of fracture. We have open fracture, long bone fracture, and si green stick fracture. Si open fracture, meron siyang open wound. Patient is at risk for infection kasi nga open yung wound niya. Management dyan kasi risk for infection. Pag nagka-infection na, antibiotic. Pwede ring tetanus toxoid kasi nga especially if it's being hit by foreign objects, no, na may kalawang or whatsoever. Cold compress, pwede dyan sa open fracture. Si long bone fracture naman, there is a release of fat globules through the bloodstream. It will dislodge through the airway, no? That will lead to pulmonary embolism. And it will cause petechial rash on neck and chest, which is pinpoint red rashes on the neck and chest. Si green stick fracture naman, rugged edges, common naman to sa pedia. Management or all fracture management, we have ISCA. We have to immobilize the patient, support using slings, cover the site with sterile gauze, soak with sterile solution, and assess for pulses, distal pulses. Signs and symptoms for all fracture. We have spaced soft tissue edema. We have pain, either sharp or continuous. Asymmetry. Crepitus, clicking sounds in bones. Ecchymosis, deformity. Surgery, if cast won't work, we have reduction and fixation. Reduction, open or close. Open goes with internal fixation. Si close naman is the manual manipulation. Example, chiro alignment. Fixation, it's either external or internal. Ayan. So, side notes tayo. Ito yung mga naipon kong side notes from my previous review. Cystatin, this is an antifungal drug. Swish and spit or swish and swallow, because esophagus also gets infection. Don't drink water within 15 minutes. Synovial fluid, this lubricates and cushions the joints. Watch out for synovitis and infection of the synovial fluid presented by white cloudy color. Febuxostat, if allopurinol does not work, use febuxostat. 14 to 30 days, then stop because this is nephrotoxic. increases creatinine, which causes blindness. Diet, personal opinions, the best management for gouty arthritis. Self-discipline. Plantar fasciitis, not part of any arthritis. It's the pain in the heels. PTH brings calcium from bone to blood. PTH brings calcium from bone to blood. Calcitonin brings calcium from blood to bone. Hypercalcemia, too much calcium in the blood, caused by calcitonin. Kayaksilate is a potassium binder. Calcium and phosphorus are opposite. If there is an increase in calcium, there will be a decrease in phosphorus, vice versa, inversely proportional. Nicotine impairs calcium in the body. Progesterone side effects, gynecomastia, constipation. GGG, garlic, ginkgo biloba, ginger promotes bleeding. Bone density, bone covering. DEXA, dual energy X-ray absorptiometry. Measure bone density, no need consent, no calcium supplement within 24 to 48 hours. Prior procedure. Vitamin B1 thiamine, vitamin B6, pyridoxine. Si gouty arthritis, due to high purine diet, management niyan is, ayun, napag-usapan na natin to. Ginawa ko kasi parang meron akong portion na may mga mnemonics para pwede ko na siya balikan from time to time. Ayun lang. So, if it works for you, because itong video na to, ilalagay ko siya sa YouTube ko, tapos papakinggan ko na lang siya na papakinggan kapag pag meron akong extra time. So, in that way, refresh pa rin ako sa mga napag-aralan ko. Ayun. So, thank you for watching.